You may not realize this, but in order to get full range of motion of your shoulder, your rib cage actually has to expand like an accordion to get that full 180 degrees all the way up to your head. Now that rib cage will kick in when you start to get above shoulder height. So if you have a rib cage that can't move to its full potential, this may be an underlying cause of your shoulder pain. There's two main things you can do to address this. The first is seated thoracic side bending. You can cross your arms over your chest, or if you can get your hands behind your head, that's even better. You're gonna see which way you move more to begin with, left or right. If it goes easier for me to the right, which it does, I'm gonna start that way, get to end range without bringing my hip off the bench in this case, and then deep breath, hold for 5 seconds, exhale, bring it back home, repeat 5 times, then I'll go in the other direction. The second version is non-weight bearing. You can lie on a bench or your bed or even over an exercise ball for an increased stretch. You're gonna bring that arm again behind the head until you feel some restriction and some tension. Deep breath in, hold 5 seconds, 5 repetitions, flip and do the other side. The side that you're on, in this case I'm on my left side, is opposite from the side being stretched. So this top side is the stretching side. I'm working on increasing that side bending. This tends to be a little bit easier because it's non-weight bearing. Progress to that weight bearing version, and within a few times, you should notice an increased range of motion for that movement out to the side. Your rotator cuff could be a cause of your shoulder pain. Watch this video to find out how to exercise it properly. Subscribe for more pain relieving and performance enhancing content.